Hi everyone, my name is Dr. Dan Sechiunga. Welcome to this channel where you get to know more about your health. You ask a question and it gets answered. We are trying to bridge the gap between the person out there and the doctor by equipping you with the very right information. So someone asked an interesting question that how may I know if I have a normal or an abnormal vaginal discharge? Of course it was a female. So in our video today, we're going to tell you the difference between the two. We're going to tell you the prevention. We're going to tell you management. We'll be right back. Hi, welcome back to the channel. Like I earlier told you, today our topic is vaginal discharges. We're going to differentiate between the normal vis-a-vis the abnormal vaginal discharge. How you can prevent the abnormal vaginal discharge and how it can be managed. So let's dive in.
Thank you so much, our viewers. Like my colleague has said, today we are talking about vaginal discharge. A vaginal discharge is anything that comes out of the vagina. It can be in different forms, different variations. Most times it's a normal occurrence, okay? But then there are situations where it is abnormal, especially when it comes with other symptoms like itchiness, burning urination, foul smell, that is a bad smell, and then probably the discharge is too much. Okay, so to let us understand better, we are going to go into the different colors and the different consistency because this is how we are going to understand it best. So a normal vaginal discharge, it looks clear to creamish white and it is sticky, just like an egg white. Most of us have touched an egg white before. Okay, it is not foul smelling. It normally happens around ovulation, okay, or during sexual arousal, even when we are anxious. Okay, we are stressed, we can get this normal vaginal discharge. Okay, the other variation is one which is red. When we look at red, all that comes into our mind is bleeding. Okay, so when we look at red and we are in our periods or immediately before our periods, then we know this is because of the periods. But then when you are not in your periods and you're seeing a red discharge, it could mean anything. Probably you're bleeding from the uterus, you're bleeding from the cervix, you're bleeding from the vagina, and this can be from something like an injury to even a cancer. So when this happens, please don't stay home. Seek medical advice. The other discharge could be brown, okay? Brown normally happens before or immediately after your periods are over. So when we see this, most times it's normal. Then there's one which is very abnormal, a green light discharge. It has a foul smell and it will present with a lot of things. Itchiness, wounds or sores around the vulva, painful sexual intercourse, painful urination. This can only be trichomonas vaginalis. Trichomonas vaginalis is one of the most common sexually transmitted infections, even more than chlamydia or gonorrhea. Unfortunately, most times it goes unnoticed. Why? Because it can be salient without symptoms. So when you see this greenish discharge and it's foul smelling with all those other discomforting symptoms, please don't stay home. Seek medical advice. Then we have a greenish yellow discharge. It is light, it is foul smelling. It will come with these other symptoms as well. This can only be chlamydia or gonorrhea. So when we look at this, please let us seek medical advice. Then there is one variant. It comes in white. It is like spoiled milk and it presents with a lot of itchiness. Many of you have experienced this, okay? This can only be candidiasis. Candidiasis is a fungal infection, okay? You're going to see these in situations where your immunity is suppressed, maybe in diabetes, maybe in HIV, or other conditions that depress your immunity. Most times, the treatment comes in tablet form or pessaries, a grayish light discharge, and significantly smells like fish. Many of you have had a meal of fish before. You can't miss that smell. This can only be bacterial vaginosis. When you see this, please seek medical advice. To recap, like we have said, anything that is not normal, that doesn't come in form of clear to creamish white and sticky, anything that smells bad, anything that will give you all those discomforting symptoms, please, it is not a normal vaginal discharge. Thank you so much.
Hi, I guess at this part of the video where you're asking yourself very many questions, and I suppose one of them is, why bother? I'm here to tell you some of the complications of having an untreated abnormal vaginal discharge. Other than you being very uncomfortable walking around with an abnormal smell or odor, a vaginal discharge can also impact your quality of life. Other complications may include female infertility. Gonorrhea and chlamydia, like we saw in our first video, they cause something we call pelvic inflammatory disease. The video is in the link shown up here. Pelvic inflammatory disease, we said, is an infection of your entire genital tract. Now, once this infection goes into your genital tract, it will cause an insult there, and eventually healing will happen by scarring. So, for example, if your tubes get scarred, you may eventually have blocked tubes, and this may give you difficulty in getting children. Trichomonas vaginalis is another one. It likes damaging the male testis. Remember, testis is the factory of sperms in a male. Now, men affected with Trichomonas vaginalis tend to develop low sperm count. So a man, you may be out there unable to have children only because they were affected by Trichomonas vaginalis. Let's find out some of the preventive measures in combating abnormal vaginal discharges. So as we previously saw in our first video, hygiene is very key, especially for females. So as we said last time in our previous video, which is in the link up there, you're supposed to clean yourself upwards going downwards. If you do up and down movements, you move bacteria from the anus into the vagina. 2, putting on cotton panties is very important because cotton tends to absorb sweat, and these organisms tend to love growing up in a very wet environment. So once you put on cotton panties, you tend to avoid such infections. The other one is, of course, practicing safe sex, and that is putting on protection while having sex. The other infection that can be prevented is bacterial vaginosis. As we saw earlier, it smells like rotten fish. Now, this is usually seen in ladies who do what we call douching or who introduce vaginal deodorants. Now, once you do this, you kind of change the environment of how God made it to another environment. This new environment will allow overgrowth of these bacteria that are found in the vagina, and they will eventually form this bad odor which smells like fish. I hope you've watched until the end of this video and you've actually liked it and learned something out of it. So as we have seen, vaginal discharges can either be normal or abnormal. The abnormal vaginal discharges can be prevented by doing hygiene, safe sex, and avoiding using vaginal deodorants or douching. So don't forget to like this video, don't forget to share. Someone's life out there may be impacted because you shared this video. So like, share, comment, click the notification button so that you may be notified when we post our next video. Comment with your question. As you can see, we get these questions from what you ask us. You can also send us a question directly through our email. SEDOC Health, Ask the Doctor.